Please subscribe to my channel and hit the bell icon to get the notifications quickly. Today we are going to talk about femoral triangle. Femoral triangle can be studied thoroughly and efficiently in 5 headings, that is introduction, boundaries, diagram, contents, and the clinical importance. So first of all, we are going to talk about introduction. In the introduction, we talk about the definition of femoral triangle. So what is the femoral triangle? The femoral triangle is actually an intermuscular space. So what is the situation of the femoral triangle and what is its shape? That is triangular in shape, present at anterior of the thigh in its upper 1/3. So what is femoral triangle? It is an intermuscular space that is triangular in shape and present anterior of the thigh in its upper 1/3. So what are the boundaries of the femoral triangle? So since it's a triangle, so it must have some boundaries, that is 3 boundaries. So a medial boundary, a base, and a lateral boundary. So the medial border of the femoral triangle is formed by adductor longus muscle. Adductor longus, its medial border. The medial border of the femoral triangle is formed by the medial border of adductor longus. The base is formed by inguinal ligament, and the lateral border is formed by lateral border of sartorius. Medial border of sartorius. Medial border of sartorius. The lateral border is formed by the medial border of sartorius muscle. So floor of the femoral triangle is formed by 4 muscles, and the adductor longus itself form the floor of the triangle. Adductor longus not only formed the boundary but it also formed the floor of the femoral triangle most medially. Adductor longus most medially, then pectineus, then psoas major, and most laterally iliacus muscle is present. Roof of the femoral triangle is formed by skin, superficial fascia, superficial and deep fascia. So these are the boundaries of femoral triangle. So we are going to draw a diagram. This is 2 landmarks of the hip bone, anterior superior iliac spine, anterior superior iliac spine, and this is pubic tubercle. Between these 2 landmarks there is the attachment of inguinal ligament. So this is inguinal ligament that is formed the base of femoral triangle. Now for the medial border, this is adductor longus, the medial border of adductor longus, and for the lateral border, this is the medial border of sartorius muscle. The floor is formed by four muscles, that it is adductor longus itself, pectineus, psoas major, and iliacus muscle. So this is inguinal ligament, this is medial side and this is lateral side. Adductor longus not only form the medial border but also form the floor of the femoral triangle most medially. So this is also adductor longus. This is pectineus muscle. This is psoas major and it is actually the tendon of psoas major muscle. And this is iliacus muscle forming the floor of femoral triangle. So this is base, this is medial border, this is lateral border, and this is the apex of the femoral triangle. The apex is formed where the medial and lateral boundaries crosses over each other. So now moving forwards, we are going to talk about the contents of femoral triangle. These are so easy. Femoral nerve, femoral artery, and femoral vein. Femoral vein if we are moving from lateral to medial side, and lateral cutaneous nerve of thigh, femoral sheath, lymphatics, and posterior branch of obturator nerve. So femoral nerve, femoral artery, and femoral vein if we are moving from lateral to medial side, lateral cutaneous nerve of thigh, femoral sheath, and lymphatics, and posterior branch of obturator nerve are present in the femoral triangle, and these are the contents of the femoral triangle. So at the last, we are going to talk about the clinical importance. Clinically, it is most important because it houses the femoral nerve, femoral artery, and the femoral nerve, the important vascular bundles of the lower limb. So the femoral nerve, femoral artery, and femoral vein lies most superficially in the femoral triangle, and they can be exposed there for surgical purposes. So femoral triangle can be exposed if we in the minor operations of the heart to pass a catheter towards the heart for minor operations. And the femoral vein can be exposed there for intravenous dripping.